Okay, we're talking to Bruce now about what happens to the ageing face and why you'd use fillers or these volumizers from a medical perspective. We're not talking about younger you here. What I'm concerned about is the facial shrinking that's going on. And I'm wondering whether if I can do something to these top temples, it might just regenerate some of the tissue. There's also issues around your skin. You want to make sure your skin remains supple, and we try and regenerate some of the collagen. So, Bruce, what happens, why am I losing all this fat, and what does the filler do in terms of
well, as we age, we lose tissue, and we lose not only soft tissue, but we lose bone as well. So the first thing you're losing under there is bone, and that happens as we age. Then we've got soft tissue over that in the form of muscle, and then we've got some fat over the top of that. Now you're very lean, Kate, which is a good thing, but that often means that you've lost some of the fat out of your face. Yeah. And we start to get separation between fat pads that looked like they were continuous fat when we were younger. Yeah. The main areas that we tend to lose, we get a hollowing out of the temples, and that's what we're going to address, one of the things we're going to address with you this morning. And that can give you a scooped out, skeletalized appearance up there. You can also get a loss of volume along the orbital rim, and as that you age, the actual orbit changes shape. It gets bigger and it drops down more as a trapezoid rather than as a square. And that causes a loss of volume under the eye, which exposes the orbital rim. So we'll put a little bit of filler just along the orbital rim to hide that. And then also as we age, we get a separation in the fat pads down through the middle of the cheek. And that gives you that drawn appearance with this flatness here and this overhang, which gives you the nasolabial fold. So you've had some filler in there in the past. We may put a little bit more in there for you today just to keep that going. And then another area that tends to happen that tends to lose volume as you age is along the jawline, and you get a loss of volume in the corners of the mouth with the lips turning, the corner of the lips turning in, and a sculpted out appearance in the chin. Once again, you've had a little bit of filler in there already, but we may put a little bit more in there for you today. Okay. So those are the things we're going to address.
So by doing the filler, will that stimulate stuff as well to sort of slow down the aging process? Is that current thinking?
Certainly, there's three basic ways we can use filler. Yeah. We can use a thicker filler down underneath the skin to recontour the face, which is what we were doing in the temples and the mid-face. We can inject a thinner filler into the skin itself to lessen wrinkles and strengthen the skin, and then we can inject some very thin filler, which we're going to do later with you, right into the surface of the skin as almost an injectable moisturizer, as a sheet underneath the skin, and that will have a skin stimulating effect. So the deeper filler tends to recontour, and you can get a little bit of collagen ingrowth around that, but basically as that degrades, you may well need some of that put back in. Yeah. But when we're injecting actually into the skin itself, it stretches the fibroblasts or collagen producing cells and causes them to produce more collagen. So by having repeated treatments of this sort, it rehydrates the skin, keeps moisture in it, stimulates collagen, and actually has a prophylactic or a long-term improvement effect on the skin.
So how long will this last?
The thicker filler that we put in the temples and the mid-face will last somewhere around the 12-month mark. Having said that, sometimes it beds in a little and you need to top that up, but the filler itself will last somewhere around the 12 to 18-month mark. Right. The filler we inject into single lines like here will last somewhere in the vicinity of 6 to 12 months. And the filler we inject into the surface of the skin, we normally recommend having 3 treatments maybe a month apart with that to get a reservoir of hyaluronic acid in the skin.
Is that right?
To actually get the most out of that treatment, skin boosting results out of that treatment. And that kind of, even though the filler then may last only as little as 6 months, the effect of stimulating the collagen is more a long-term benefit that will need to be aged away depending on where you are in the aging curve.
Okay, so tell me, we're using, what filler are we using today?
We're using a range of fillers called Teocel, which come from Switzerland. They're a range of hyaluronic acid fillers. We're using 3 products out of their range. We're using Ultra Deep, which is their thick product, which we're going to use for recontouring your temples. We're using another product called Ultimate, which is a medium density product, which we're going to use in the nasolabials and the mid-face. And then we're using a product called Redensity 1, which we're going to inject. It's a very thin, non-cross-linked hyaluronic acid filler, which we're going to inject as a sheet over the skin.
Right. So are there any possible side effects?
Whenever you stick needles into the skin, there's always the possibility of getting infection or bruising, or I should say bruising or infection. You may well get some little bruises. Bruises will go away. Infection is very rare with this type of thing if we follow normal aseptic procedures and we use good technique. There are very rare complications with this type of thing, but most of the time hyaluronic acid fillers are very, very safe. Everything we do today can be covered with makeup, and you can use a range of breathable camouflage makeup. We've got a product here, Oxygenetics, which you can use.
What's the cost? If someone wanted to do temples, What's an indicative cost depending?
Okay.
It's how many mils or something, isn't it?
Absolutely. Filler comes in preloaded syringes of either 1 mil, 2 mil, or 3 mils.
Right.
My normal rates for charging, I charge $660 for the first mil of filler I use, $550 for the second mil, and $440 for subsequent
So
mils.
you just build that into the cost?
Yeah.
All up.
In the temples, you're looking at somewhere between, depending on how much the deficit, 2 and 4 mils. So that would be somewhere between $1,200 and $2,000, and that's likely to last in the temples about a year or so.
Yeah. Yep. And in terms of the these skin rejuvenation plumping out business, how many mils would you use? That's the really thin one.
That's a thin filler. Yeah, we use 3 mils of that filler injected into your skin per treatment, and that costs $990. That filler is a little cheaper, and because it's a package it up as a treatment for those 3 mils, it's $990. And I recommend having that treatment 3 times, about a month to 1 to 2 months apart.
And then that sets a baseline, does it?
Yes.
And then after that, what you do it in 12 months?
I top up every 6 to 12 months. It doesn't change the shape or the contour of the skin, but it plumps up the surface and gets rid of fine lines and wrinkles. It also gives a moist dewiness to the surface of the skin and some reflectance or luminosity. It'll also make makeup go on more easily, and it'll make people look like their skin's more even in texture, basically.
How does that work? Does that work well for the neck as well?
Can also use it on the neck. Most of the time on the neck I would be adding in platelet-rich plasma in there, which is where we take blood from you, separate out the platelets and mix that in to get a rejuvenation in the collagen there. You've got to be careful in the thin neck skin when you inject any type of filler, even thin filler, that you don't leave any lumping or ridging. And so it's quite a difficult thing to inject.
So, and what do you do? So how do you avoid that? You know that you're using a gun.
Yeah.
So tell me about the gun.
Today we're using what's called the vital injector gun too. That's an injecting device which injects the filler in very small amounts evenly over a surface. So it's got a little disposable needle cartridge with 5 needles. It sucks up the skin and puts those needles in a very accurate depth to the mid part of the skin and injects very small amounts of product. And then we can repeat that all over your face, resulting in the product being evenly distributed just under the surface of the skin where we want it. If we're doing other areas like the neck or even the face, we can also mix with the products and plate the rich plasma to get more of a long-term rejuvenating effect.
So would you use a gun on the neck?
Yes, absolutely.
Yeah.
With the gun, you will get a few little bruises afterwards, but they're surface bruises.
Right.
They can be sometimes lasered if the person has fair skin, and we can laser those to make them go away.
But you do the lasering before, because you wouldn't laser over the top of the filler, would you? Because it could degrade it.
No, the type of laser I'm talking about for this was vascular laser to break down bruises. This is just a technique to get rid of little bruises.
Oh, I see.
As a rejuvenation treatment. But we could inject the PRP and filler over there. You'd have some small bruises, but it certainly has a rejuvenating
We should
effect.
do another session with the neck, do before and after, because I think that's a big issue for women.
Then we can talk about PRP more.
Yeah, that's right.
We should keep it mainly on the soil today. Excellent.
Right, fantastic.
No problems.
So what do I do now?
Shall we stop filming straight a second? I'll get myself ready and I'll start injecting it. I'll get my glasses and things. I just want to ask Richard one